Joining us once again on the programme, the Vaccines Minister, Nadhim Zahawi. Mr Zahawi, always good to have you on. And as always, a very busy day, very busy week for you and the rest of the government. Clearly, everyone is very keen to discover how and when we might be exiting lockdown. And at the core of all of that are the 4 tests that the Prime Minister is deploying. Run us through those.
Good morning, everyone. Yes, of course. So it will be, first of all, the vaccine programme continuing at pace. So we will offer the vaccine to the over 50s by the middle of April and all of the adult population by the end of July. The second is that the vaccines are working and that we're seeing a reduction in infection, hospitalisation, and of course, death. The third of which is that infection rates are not rising because of the different parts of the opening up of the economy to a level which will overwhelm the NHS and, of course, in terms of hospitalisation. And the fourth is variants, i.e. that we are managing to keep variants under control and that we're not seeing what we saw, sadly, just before Christmas, which is the new variant becoming more infectious and the dominant variant in the country and leading to the large-scale hospitalisation that we saw in December, January, and of course, even now. So they are the 4 tests. It is making sure that we proceed at each step and are able to assess and then flex accordingly. But you'll hear more from the Prime Minister, both in the Commons when he presents the roadmap, but also tonight in the press conference.
Sure, and there will be parents the length and breadth of England looking enviously at the date of March the 8th for all the schools to reopen. However, just in terms of the 4 tests that you've outlined, the second of those, the evidence showing that vaccines are reducing hospitalisations and deaths in those vaccinated, do we yet have that evidence? Do we yet have that information? Certainly not in the public domain by my reading.
So the Prime Minister will say more about this, but you will know that Public Health England have been running a couple of large-scale studies. The Siren study, which it tests the frontline health care staff who were in Group 2, if you recall, of the vaccination programme, so very early on. And another study called Vivaldi, which has been testing care home residents. Again, they were Group 1. And, of course, the other evidence. But the Prime Minister will be saying more about that. Suffice to say, the evidence looks good. The Oxford team demonstrated their own evidence of cutting transmission by 2/3. And of course, we wouldn't be in this place this morning to be able to say that we're going to reopen schools on the 8th of March. And of course, as the school holidays begin on the 29th of March, we will look at the rule of 6 and 2 families being to see each other outdoors. If we haven't, if we're not confident that actually the vaccine programme is beginning to really bear fruit.
Sure. Can we just be absolutely clear, though, with all schools reopening on March the 8th, the expectation has to be that the number of infections will increase? So
that, as I was saying to you at the beginning, all of that goes into the gradual, cautious reopening of schools and then gradually reopening the rest of the economy. As we vaccinate more people, it is not a coincidence that the 8th of March is the date that we have focused on, because if you take the mid-April date where we will have given at least 1 dose to all over 50s, offered that 1 dose protection to all over 50s, if you go 3 weeks after the middle of April, that takes you to the first week of March. Now, that phase 1 is 99% of mortality. So it's no coincidence that we are opening schools after 3 weeks of protecting the over 50s and that phase 1, and then we'll carry on.
I get that. Sorry to interrupt, Minister. The reason is we have heard for a few days now, in fact, and from yourself on the programme last week, that the way out of this is to be incredibly cautious, is to open things gradually. I mean, the one aspect of the roadmap in which it doesn't feel particularly gradual is getting kids back into schools. You look at Wales, you look at Scotland, they're going in a phased return to school, so they can look at the data, see what happens in schools as children go back. Why are we not doing that? Because it doesn't feel cautious. It feels somewhat incongruous, actually, to reopen all the schools on one day and say that this is a cautious approach.
Well, I would say to you, it's actually quite the opposite. If you look at where hospitalization and, of course, death has come from with this pandemic. It is from that 1 to 9 group, all the way from the over 80s, those obviously that are clinically extremely vulnerable, but then also the over 50s. So we're waiting until all of that group, the over 50s, have got the protection, i.e. 3 weeks after getting their first dose, before we reopen schools. And of course, we do know that infection amongst children is very, very low. And so this is a cautious, slow and deliberate reopening as we continue, of course, to assess the 4 tests that you and I have just described to your viewers.
Mm-hmm. I understand that certainly some of the evidence that it suggests that transmissibility amongst children is it's not as much of an issue as it is amongst yourself or myself. But you only need to look at, for example, I mean, there are examples of this all around the world. The situation in British Columbia and Canada at the moment, where the Kent variant is running havoc through the school system there, a number of schools having to have temporary closures. Look, we understand that the plan, as outlined by the government, is that we don't roll back. Once something is relaxed, that is the way of it. But you have to say that there could well be a big pause in this roadmap coming as we look at the data that emerges from the school system.
So hence why the 4 tests, if you go back to your first question, the dominant variant in the UK is the one that you refer to as the Kent variant. The vaccines have very high efficacy against the dominant variant, which is why we're confident on the vaccine effectiveness. The vaccine rollout continues to be going to plan. We've in fact brought it forward, more ambitious, by mid-April to offer the vaccine to over 50-year-olds, all over 50-year-olds. But there is a but in there, which is to say we have to make sure that infection rates and hospitalization also remain under control, which is the 3rd test. And the 4th test, back to your Canadian example, is that we keep control on variants and make sure that we have that ability to sequence, which we have, genome sequence, one of the largest in the world. We account for about 50% of all sequencing of COVID mutations. And of course, surge testing and isolation, as we've been doing with the variants that we've discovered from South Africa, for example, and make sure we keep that under review and control. So it is cautious. We have to be careful. We want it to be sustainable, as you quite rightly described.
Can we talk about the second key date in all of this, March the 29th, which you've already mentioned? Of course, the suggestion is that might be the point that we see the end to stay at home, indeed the end to stay local. Plenty of people up and down the country, myself included, will be wondering if that is the point at which those of us who live some distance from our families might be able to go and see them. Outside, of course, you're not allowed indoors. Is your reading of the relaxation that people can travel at a distance to see their family on March the 29th, if everything goes well?
Quite right. If everything goes well, this is outdoor versus indoor. We know there is plenty of evidence to suggest that outdoor, the transmission is much lower. It is allowing 2 families to be able to come together outdoors, or the rule of 6. And it is a national rule rather than a regional or tiered rule. So I think the important thing is to wait to hear from the Prime Minister this afternoon in Parliament, but also this evening on the details.
Sure. But I will push a little bit on this. My producer working with me this morning, he lives in Leeds. It might be possible for him to get home and come back in a day, whereas for me, to go home and see my family would potentially involve an overnight stay in Scotland. Of the 2, are either of those, in your mind, either not possible, not permitted, or not advisable?
So as long as it's outdoors and it is 2 families or the rule of 6, then that is what will be permitted. If the 4 tests continue to be delivered upon, then that will be the national lockdown. Of course, Scotland, as you mentioned, and Northern Ireland and Wales will be setting out their own roadmap towards reopening their economies as well. So At the moment, the focus is very much on, steady as she goes, outdoor versus indoor, priority being children in schools. Second priority is obviously allowing two people on the 8th of March to meet outside for a coffee to sort of address some of the issues around loneliness and, of course, mental health as well. And then the 29th is two families or rule of six coming together and outdoor sports activities as well. Tennis,
Can
golf.
we then... Oh, sorry, Minister. Can we then just be absolutely candid? Even on the roadmap, as I understand it, even in the best case scenario, pubs, restaurants, non-essential shops, hairdressers, beauty treatments and the like, none of that will be happening, even in the best case scenario, until the other side of Easter.
Well, however much tempting it may be, Neil, I will not preempt my Prime Minister before he stands up in the chamber, the dispatch box, and describes the roadmap to parliamentarians and to the country, and of course at the press conference tonight. I think it's important that we do this cautiously, steadily, based on the vaccination rollout, which has been, I think, in many ways, one of the great achievements of the coming together of the NHS, our armed forces, the volunteers, the doctors, nurses, the private sector that delivered the vaccine, both in terms of the scientists and the manufacturers, but also that delivering now for us in the deployment with the distribution. So a lot of hard work has gone in, and we don't want this hard-won, achievement to be in some way jeopardized by us, emotionally feeling that we've got to try and go faster. We've got to be led by the data, not the date.
And very, very quickly, because I know you have to go, can you offer a cast-iron, set-in-stone guarantee that there will never be another national lockdown?
I think the important thing is to make it sustainable. You're absolutely right. Now, the Prime Minister, if I look at my own portfolio, has tasked us not only to deliver the largest vaccination program in the history of the NHS and of this country, but also to look at variant vaccines that may be needed as an autumn booster if we need it, and of course a longer term future-proofing of the vaccination program. So I'm confident that if we do this cautiously and we do it based on the data, the evidence, then it will be sustainable. And it should be the last time we ever enter the severe level of lockdown because of COVID-19.